When preparing for JCI accreditation, regardless if it's for clinic or a hospital, one of the most important and popular area for healthcare organizations that requires focus is quality and patient safety, commonly referred to as QPS standards. In this video, we'll cover the most frequently asked questions related to JCI's QPS standards, explained in simple terms. Please remember, this is one of the favorite topics of the assessors. Before we start, remember it is absolutely fine to say that I will get back to you with the asked information. You are not required or forced to answer on the spot. Let's start with the questions. The first question is, do you have a quality and patient safety program? Every JCI accredited facility must have a structured quality improvement and patient safety plan, covering all departments, patients, visitors, and staff. Next question is, what activities are included in a quality and patient safety program? These include clinical and managerial KPIs, incident reporting, risk assessments, patient satisfaction surveys, professional practice evaluations, and self-assessments like infection control reviews. Another common question which is widely asked, how should KPIs be structured? KPIs must be SMART: specific, measurable, achievable, relevant, and time-bound. Without SMART KPIs, audits and performance tracking become unreliable. One of the most critical questions is how is the QI and patient safety program communicated to staff? Through quality committee meetings, internal bulletins, biannual reviews, and patient feedback systems. Next question is, do staff receive education on QI and patient safety? Yes, both during onboarding and through mandatory annual training. The next interesting question is, what quality improvement model or performance improvement tool is used in your organization? The PDSA cycle is widely accepted: plan, do, study, act, driving continuous improvement. You can always have different tool implemented depending on your choice, but staff must be aware at least. Next question is, who is responsible for quality improvement? It's not just the quality department, all staff are involved. Multidisciplinary teams lead specific projects. A common query is about performance improvement projects, or PIPs. These are launched when a KPI fails for 2 consecutive periods or consistently underperforms over 3 months. Next question is, are staff involved in QI activities? Yes, from frontline admin to doctors and pharmacy staff, everyone participates in projects such as reducing patient waiting times, medication safety, or infection control compliance. Another frequent question, how is data validated? Answer is by assigning a second reviewer, using valid sample sizes and targeting over 90% accuracy. Next, a general question. What is a sentinel event? A sentinel event is a serious incident like surgery on the wrong patient or permanent injury, requiring immediate reporting, root cause analysis, and official follow-up with authorities. So, how are incidents and near misses actually reported? Well, it's done through structured electronic systems like QR codes, which really help ensure real-time reporting. And finally, about risk management. Do you have risk register? Every organization must analyze its risks and maintain a risk register. The next question in relevance to this is which tool you are using for risk analysis and what is FMEA. FMEA, or Failure Modes and Effects Analysis, is a proactive risk management tool that's used to analyze high-risk processes before any issues actually occur. These are just some of the most common questions that auditors ask under JCI's QPS standards. Having clear, structured answers, backed by data and real examples, can make a big difference during your next inspection. For more simplified accreditation and healthcare quality content, please subscribe now to The Quality Pharmacist.